Yes, please take a seat and make yourself comfortable. You're here today for an eye exam, is that correct? Yeah. Oh, you're in a bit of a rush today, is that right? Okay. Yeah, I'll perform the eye exam as quickly as I possibly can then, and maybe I can try and squeeze it down to about 10 minutes. Is that okay for you? Sounds good. Okay then, we'll start right off the bat. I'm going to hold up this eye chart. First of all, can you see the eye chart? Excellent, your eyes are fine then. That concludes the appointment. I'm joking, of course. Sorry, maybe we don't have time for jokes. Let's take this more seriously. So, if you can sit back in your chair, please don't lean forwards. I just want to get the correct distance between you, yourself, and the eye chart. Both eyes open. Can you read through the letters for me, please? Yeah. 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 Excellent. Yeah, very good, very good, very good, very good, very good. Starting to struggle a bit. That's okay, yeah. No problem. Any on the bottom line? Okay, no problem. Now if you could cover one eye for me, please. That's perfect. I'm going to point to random letters. If you can read them for me, please. That's good. That's good. That's good. That's good. That's good. Marvellous. If you can cover the other eye now for me, please. Very good. Same thing. Random letters. Good. 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 That one, no. That's okay, no problem. Okay, you can uncover the eyes now. Can you please identify the colours for me as well, please? So, this one here. Perfect. This one here. Brilliant. Okay, now I'm just going to quickly look into your eyes. So, right now I just want to do a very quick observation. So, actually, if you could look up for me, please. Very good. Very good. And if you could look down for me, please. Yeah. That's good, that's good. If you could look to the right, please. Okay, very good. And then the left as well. Very good, marvellous. Now I would just like to cover one of your eyes, and I'm going to be just observing how this eye is responding on its own. Yeah, looking good, looking good. I'm going to cover the other eye now. Okay. Yes, very good, very good. I'm going to split them down the middle, so to speak, just placing my hand on your nose. I'm just observing how the eye responds when only one eye is exposed to light stimulus. Okay, that is looking good, excellent. Now I would like you to follow the light with your eye. Keep your head still though, please. Okay, how are you feeling during this? Do you feel much strain in the eyes caused from this movement? No? Okay, that's a good sign. Very good. Excellent, very good sign. Okay, now I would just like to check your focus, so if you can keep your eyes on my fingers here, please. I'm going to just move them closer and further away. I may use my light as well, just to help me see how your eye responds. Okay. Looks like a very fast focus time, which is what we're looking for. Just going to try with this one now. Very good, very good. So how would you say your eye health is? In general, do you feel any strain with your eyes? Do you get any headaches or anything of that nature? Okay, that sounds quite good. What I'd like to check now is your peripheral vision. So I'd like you to just stare directly ahead. You can focus on my nose, for example, and then I'm going to move my fingers like this, various directions, and I would like you to tell me, please, when the fingers leave your field of vision, okay? So we'll try that now. That's good. Try again, different direction. That's good. Try again. That's good. Try vertically. That's good. I'm going to try different distances now from you. That's good. Nice one. And we'll be going for vertical, up close. Very good. Diagonal, up close. Very good. Same thing, opposite direction. Very good. Now we'll do one far away as well. That's very good. That's right. If you could do this directionally one. Diagonally, very good. Same thing, going here. That's excellent. And now vertically. Very good, marvellous. Peripheral vision looking good. Now I'm going to be looking at how you detect motion at the edges of your peripheral vision. So I'm going to be wiggling my fingers. I might wiggle just one, the other, both, something like that. And if you could tell me left, right, or both, please, when you detect movement again. Still focusing on my nose, please. So here we go. Very good. 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 That's good. That's good. That's good. That's good. Great. 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 Marvelous. Brilliant. That's good. That's good. That's good. That's good. Very good. Okay, peripheral vision looking good there. So I have to say, looking very good so far. Your eyes look like they're performing well. Something I have noticed though is that your eyes look a little bit weird. They have a weird size and shape. There may be some asymmetry going on there. So I just want to take some measurements if I may. And I'll keep these for my notes. I don't think there's anything to worry about, but I do just want to measure your eyes, if that's okay. Yeah, and characteristically long eyes. Perhaps it's not necessarily a bad thing. Are the final measurements that I need to take. Okay, I've actually concluded the eye exam today. Got all the information that I need. It seems like your eyes are very good. There's no need to worry about me measuring your eyes. I do that with a lot of people, just to check for things like asymmetry. It can be hard to tell just from looking at someone, but actually upon measuring your eyes, they look perfectly fine. Perhaps a little bit larger than average, but not necessarily a bad thing. I may even contribute to better vision, who knows. Do you have any questions for me before you leave today? No? Okay, I just want to quickly type up some of your results from the measuring part. Sorry. Okay. And I do believe that's everything I need from you, yeah? Yeah, thank you very much. Sorry to keep you for so long. Hopefully it was short enough for you. Hopefully. Okay, goodbye. Thank you very much for coming today. Thank you. Goodbye. nice to see you today. Please make yourself nice and comfortable. You are here for a dental checkup today, is that correct? Yeah, good to see you. Before I begin checking your teeth, I might just ask you a few questions if that's okay, and I'll record the answers that you give me for future use. That's okay. Okay, so we're going to have some very simple questions here today. When was your last dental checkup? Okay, and have you experienced any pain or discomfort, any toothache recently? Okay, and what would you rate that pain on a scale of 0 to 10? Okay, and would you say it's constant or does it come and go? Do you notice there are any trigger foods that might cause this pain in particular? Perhaps hot or cold foods, for example? Okay, and can I ask, what is your oral hygiene like? What is your routine? Do you brush your teeth twice a day? Do you use dental floss? Do you use mouthwash? Okay, and what would you say your diet is like? Do you eat large quantities of sugar, either naturally occurring sugars in fruits, or do you have a lot of fruit juices and smoothies, or do you find yourself having a lot of sweets, chocolate bars, things of that nature? Okay, excellent. I think that's all the questions that I need to ask you there, and we'll begin the checkup very shortly. Okay, so for today's checkup, I am of course going to need to actually go into your mouth and inspect your teeth and your gums, and in order for me to do that hygienically, I will be wearing some latex gloves, and I will also be wearing a face mask. Okay, so I'll just pop on the gloves now. Okay, and I do believe we are ready to begin. Okay, so I'm going to be using a couple of tools to look into your mouth, and this is mostly just for my own ease, to get a better look at your teeth, and I will be using them to scrape off some plaque whilst I'm there, just to give you a bit of a clean whilst I'm here. Okay, so I'm just going to take a quick look in your mouth now. Okay. Okay, looking very healthy. Gums are looking good. Not too red. No sign of inflammation or something I see in almost every patient. This is usually just caused by the drinks that we consume. If you drink tea or coffee, those can be quite bad stainers. If you drink red wine, certain fruit juices or smoothies, fizzy drinks, things of that nature will all slightly yellow your teeth. And of course you can use whitening toothpaste. It has some effects depending on the brand that you choose. And of course, if you are really concerned, we could look at a chemical bleaching procedure, but that would be mostly for cosmetics, mostly for personal preference. There would be no real health concerns or reasons to undergo that procedure, so that would be entirely up to you. Okay, just taking a quick look at the remaining teeth. All looking very good. No signs of cavities. Very good. Okay, so I'm quite happy with what I'm seeing so far. I think now I will just do a very quick scraping across some of your teeth, particularly your incisors, the top and the front row, bottom and the front row I should say. And we're just going to remove a little bit of plaque. Okay, so you will probably be able to feel the scratching, but it shouldn't feel painful, it shouldn't feel too uncomfortable or anything like that. Okay, so I'm just going to start doing that now. Okay, we'll take a very quick breather for a moment. How are you feeling? All okay? Do you need a quick break? Do you need a glass of water before we continue? All okay? Okay then, so if you're happy, I'll jump right into the next part. I just want to quickly now look at your teeth and your gums, the inside of your lips, with just my fingers. Okay, so I'm just going to be popping them in your mouth if that's okay. Just going to be feeling around in there. And I want you to tell me in this section if you feel any pain or discomfort, in particular when I apply pressure to each of your teeth. Okay, so I'm going to be going individually along each of your teeth, and I'll just be giving it a very gentle push with my finger, and I want you to tell me if one feels painful or if two feel painful, etc, etc. Okay, so here we go. so that one there is a little bit painful, is it? And how would you rate that pain on a scale of 0 to 10? Okay, and I'm just going to press the surrounding teeth, the neighbouring teeth. Any pain for that one? Yeah, same question with the scale, 0 to 10. Okay, so a little bit less, going back to the other side of that tooth. Scale of 0 to 10. Okay, so it's just this one particular tooth that seems to be the problem in particular. And now just examining the gum above that tooth. When I apply pressure there, do you feel anything? Yeah. Scale of 0 to 10. Okay. Okay, so there's no obvious sign of cavity or anything major with that tooth. The sensitivity may be coming from the gum. Maybe just a slight inflammation. It may even be something as simple as overbrushing when you're brushing your teeth, being a little bit too aggressive or forceful against the gum with the brush. You have to remember that the gums are surprisingly delicate and surprisingly sensitive. Obviously, I think it goes without saying that when brushing our teeth, we need to be careful to focus on just the teeth themselves. You can give your gums a very gentle brush, but it should be much less vigorous than the brushing that you would typically do on your teeth directly. Okay. Okay, just finishing up my little examination here. Almost finished. Okay, so other than that one problem tooth, I can't really see anything to be worried about, which is of course very good news. Okay, so I do believe we've actually finished our dental checkup for today. A very short and easy checkup for both of us, which always a good sign. So from what I can tell, your teeth look extremely healthy. I would say your oral hygiene routine is doing you very good indeed. And I would say your diet and your daily habits are also contributing to your good health regarding your teeth. Obviously you have the one area of sensitivity. Doesn't seem to be anything to be too concerned about, but obviously I would recommend that you keep coming back every 6 months, just so that we can monitor the health of that tooth in particular, that area in particular, and if it does evolve into a bigger problem, then we will see what we can do about it. Okay, but at the moment it's nothing to be concerned about. Just be gentle with it. Try to avoid trigger foods, as you may have mentioned earlier. I think you mentioned there is a slight sensitivity to temperature, high or low temperature foods. Okay, so perhaps avoid those for the time being. Be gentle when brushing your teeth, and hopefully that pain will go away. Okay, but of course if it does get significantly worse over the next few weeks or month or so, you're more than welcome to phone and book another appointment with me. Okay? Okay, so do you have any questions today? No? All okay? Okay then, excellent. Thank you very much for coming, and thank you for sitting so well. You did brilliantly well. Yeah. Thank you. Take care. Good night. Bye. Bye. Hi there. Welcome to the office. I'm Dr. Jones. Please take a seat. Make yourself nice and comfortable. You're here today for an ear exam, and if necessary, clean as well. Is that correct? Yeah. Well, today we only have a short appointment, I'm afraid, so I'm going to be going through everything as quickly as possible, if that's okay. Okay. So to begin with, I'm going to be popping on some gloves and I'll just do a very quick visual inspection of your ears to begin with. Okay, let's take a look at your ear to begin with, shall we? Okay, everything looks to be quite good. Nothing extreme on the outside. A small amount of build-up of debris and dirt, but nothing excessive. This is typical of what I would see in most people, so I'll just quickly check your other ear now. This ear is looking very much the same as the other one actually. Nothing excessive, nothing too bad, nothing we can't clean today. Okay, very good, quick first visual inspection. Okay, so now that I've just done a very quick visual inspection, I'm going to be actually using an otoscope to get a proper look deep into the ear canal, see what we might see. Okay, so here we go. Let's have a quick peek in here. Okay, yeah, got a slight bit of redness. Nothing too bad. There is a build-up of wax, but again, nothing too bad. Should be able to clear that out in today's session. Let's check your other ear now, if I may. Okay, there we go. Very much exactly the same as the other ear, I would say. Nothing to be worried about. Just a small amount of wax build-up, which is honestly very common in most people, all people I would say. So before I begin the clean, I just want to make a few sounds by your ears just to get a general idea of your hearing ability before the clean, okay? So to begin with, I'll just start with both ears. Can you hear that? Yeah, I'll move further away. Can you still hear? Yeah, you can still hear. Still hear. You hear that? You can't hear it anymore. Okay, that's good, that's good. Do that once more. Just tell me when you can no longer hear the sounds I'm making, please. Great, great, great. And we'll try just your one ear. Very good, just the other ear. That's great. I'll just do some clicking sounds. Very good. Very good. Okay, now we have a baseline idea of what your hearing ability is like. I'm going to quickly clean your ears. Afterwards we'll repeat the same sounds and hopefully they should be clearer to you. First things first, I'm just going to pop a small amount of solution into both of your ears. This will help to soften the earwax, make it a lot easier for me to clean out. Okay, I'll just apply some of this in this ear here. Very good. Go in this ear as well. I'm just going to hold back the tips of your ears actually, if I may. And this will help the solution to flow down into the ear canal. Okay. Okay, so now I'm actually going to begin cleaning your ears. I'm just going to be using some small basic apparatus, cotton pads, cotton bud. Okay, I'll just begin the clean now, and I'll start with this here now, if I may. Just so you know as well, for your own record, so to speak, it's generally not advised to use cotton buds for your ears on yourself unless it's a trained medical professional. It's just because it can impact the earwax further and actually make things worse. You know, you can push earwax deeper into the ear canal, and if you do that it becomes more dense, more hard, more difficult to remove. Earwax should fall out of your ear naturally without any additional assistance from yourself. You can use cotton buds to clean the outer edges of the ear, so around here, not into the ear canal. That's not recommended, but the outer edges, that'd be fine. Other than that, just it should be cleaning itself naturally. But yeah, of course, no problem if you need to book an appointment with us every now and then, just to get your ears cleaned, double checked. It's always good to double check them anyway. This isn't too uncomfortable for you now, is it? No? That's good, that's good. Just let me know if you need a break at any point, of course. I'm just going to use the otoscope again, if I may, just to get a proper look, see how much progress I'm making. Okay, it's almost done actually, this one. Last look. Yeah, that ear is looking nice and clean now. Gonna do the same on the other ear now. How's that feeling? Not too bad. That's great, that's great. The solution has actually done a lot of the work for me. It's already turned most of the wax into an almost liquid state, so I'm just cleaning all that up now. Won't take long. Move on to this tool. sounds again that I made earlier. Let me know how they sound to you when you can no longer hear them. Yeah, that's good. One more time. Very good. How do those sound in comparison to earlier? They sound a little bit clearer. Yeah, a little bit louder. That's very good. Very good sign. Okay, I'm going to go with individual ears now. Yeah, one more time. How is that ear compared to earlier? Definite improvement. That's very good. Try this ear now as well. Yeah, one more time. How does that ear sound? Better as well. That's good. We'll do the clicks as well. Very good. Very good. Very good. Very good. Very good. There we go then. As long as you're satisfied with everything, I believe our appointment here is finished. Yeah, any questions for me? No, that's excellent. Thanks very much for coming today. Thank you. Yep. Take care. See you again. Bye. Hello there, and welcome to the office today. My name is Dr. Jones. Nice to see you. So you are booked in for a cranial nerve exam today, is that correct? Very good. Unfortunately, our appointment today is quite short, so I'm going to have to go through everything quite rapidly, and that is why I am already wearing my latex gloves. So I've come prepared. Okay, so first things first. Can you taste this for me, please? There we go. What does that taste like? Peppermint. Very good. One more to taste. And could you taste that for me, please? What does that taste like? Pineapple. Very good. Okay, and next we have a smell for you. Can you smell that for me, please? What does that smell like? Bacon. Very good. One more smell for you. Two things to taste, two things to smell. Smell that one for me, please. What does that smell like? Coffee. Very good, very good. Okay, I just want to take a very quick look in your ear using the otoscope. Okay, so I'm just going to take a quick look in this ear here. Have you been experiencing any trouble with your hearing recently? No. Have you felt any pain or discomfort? No. Okay, ears looking quite good. I do want to just do some very simple rudimentary hearing tests with you though. Okay, so if you could close your eyes please, I'm going to make a series of click sounds and I want you to tell me how many click sounds I make in total. Okay, so starting now. 1, correct. 3, correct. 4, correct. 5, correct. 2, correct. 1, correct. Okay, very good. And now I'm going to make a noise next to your ears like this, and it's going to move further and further away from your ears. I want you to tell me when you can no longer hear the sound. Okay, so starting now. Very good. We'll do that one more time. Very good. I'm just going to isolate one ear now. Very good. One more time just to confirm. Very good. One more time on the other ear. Very good. And the final time. There we go. Excellent. Okay, so now I just want to whisper very quietly a word or a number into ears, and I want you to repeat back to me, please, what I whispered to you. Okay, so here we go. Coconut. Good. Technical. Spoolie. Number 1. 72. 83. There we go, very good. Okay, now I'm going to start examining your eyes, and first things first, I'm going to be using 2 light pens today. First of all, I want you to just focus on my nose, please, okay? Just ignore the lights. Don't be concerned with the lights, just focus on my nose, please, okay? And I am just observing your eyes, and in particular, how your pupils respond, okay? Okay. Very good. 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 Good, looking good so far. Okay, so now I would like you to focus on the blue light, please, okay? Just keep your eyes focused on the blue light as it moves. Follow it with just your eyes. Don't move your head. Very good, very good. Okay, and I'm just going to bring one light closer, one light further away. Again, I'm just observing how your eyes respond and behave, okay? Excellent. Could you now focus your eyes, please, on the warmer yellow light for me, please? Okay, very good. Doing essentially the same thing here. Just looking at your eyes, how they respond, how they behave, okay? Okay, so follow the yellow light as it moves for me. Very good. And are you experiencing any pain or discomfort doing this? No strain or anything like that? Okay, very good. Okay, I'm just going to check the edges of your peripheral vision now. Okay, so if you could focus on my nose, please. I'm just going to move my fingers. Please tell me when you can no longer see them, okay? Very good. Very good. Very good. Very good. I'm going to take a step back and we'll do the same thing. Good. Good. Good, very good. I want to do the same thing, but very, very close now, okay? Good. 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 Okay, and I just want to bring my one finger closer to your eyes. Can you tell me if you experience any double vision? Looking good so far, yeah? One more try. Okay. No double vision during that? No, very good. Okay, so now I just want to feel around your face, and I'm going to ask you to do a few things for me, okay? So I'm going to place my hands against your cheeks to begin with. Could you puff out your cheeks for me, please? Just like that, very good. I'm going to pop my hand on top of your head. Could you push up against my hand? Very good. I'm going to pop my hand underneath your jaw. Could you try and open your jaw for me, please? Very good. Popping my hand to the side of your head. Could you move against my hand just like that? And then the opposite side as well. Very good. Okay, and now I'm just going to be popping my hand exam today, and in quite a fast bit of time, if I do say so myself. Everything is looking good from what I can see. Just going to make a few notes so that I remember the results that we've obtained today. Do you have any questions for me or any concerns about your health that you would like me to address? Okay, let's write that down. Okay, can I ask you, what's your job, please? And you spend a lot of time looking at screens doing that. How many hours do you typically do that a day? Okay, I mean that is probably the source of any fatigue that you would feel in your eyes. Perhaps even you may get a headache from time to time. From what I've observed today, you are perfectly healthy. There is nothing to be concerned about. To avoid the eye strain and the headaches in the future, all I can recommend is take regular breaks from work, stand up, walk around, perhaps go outside for a little bit. You can't be looking at a screen for hours and hours on end. That is going to affect your eyes, and it's going to give you headaches and eye strain. Also, something that people could typically do is whilst they're working, they forget to blink. It sounds ridiculous, but on average we blink less when we are hyper-focused, particularly on computer work and screen work, and this leads to dryness of the eyes. So if you think that might be something affecting you, you could try some over-the-counter eye drops. Literally all they do is they moisturize the eye, so you could definitely try that. No harm in trying. Okay, any other questions for me today? No? All okay. Excellent. Thank you very much for coming today. Thank you very much for performing so well. Good night. Hi there. Please come in, take a seat, make yourself nice and comfortable. My name's Ross. I'm going to be looking after you today. You've been referred to me for an ear, nose and throat examination, is that correct? Yeah, so what exactly are the sort of problems that you've been having? Okay, yeah. So sore throat and trouble breathing is there? Okay, yeah. So first of all, what I'm going to do is I'm going to listen to your lungs just to rule out that there isn't a chest infection or any problem relating directly to the lungs. So during this examination, I'm going to have to come up quite close and personal to you. I'm going to have to touch you in a few areas. I'll let you know before I do anything, but is that okay for me to do? Yeah, excellent, thank you. Okay, so I'm just going to start by having a little listen to your lungs, if that's okay. Just going to be placing the stethoscope on your chest, if that's okay. So if you could take a deep breath in for me, please. And a deep breath out for me, please. Very good. I'm just going to listen to a few locations on your chest. Another deep breath in for me, please. And out. Very good. I'll do one more location just to be certain. So there we go. Deep breath in, please. And deep breath out. Okay. Can't hear any abnormalities. Nothing I would consider worrying. Everything sounds normal through that. Now, if it's okay with you, I just want to do a quick feel around your throat, jaw, nose area. I just want to feel to see if abnormalities. And during this time as well, I'd also like you to tell me if you feel any pain or discomfort. So not feeling any pain or discomfort there now. That's a good sign, yeah. Can't feel any obvious swelling. Can't see anything obvious either. Just gonna palpate a few areas if that's okay. Again, I'm just looking for any discomfort or pain you might be feeling. So that's okay around there, yeah? And perhaps around here. All okay there as well. Okay. You seem to be looking pretty good externally. I think the next course of action then is for me to take a look at your throat and in your mouth, so I'm just going to shine a light if that's okay, and if you could open your mouth for me please. Okay, keep your mouth open if you can. Very good. Say ah for me. Okay, well there is certainly some redness in the throat. Okay. Can you swallow for me, please? Okay, and could you swallow once more for me, please? Excellent, thank you. Okay, I think everything is not too bad. There is obviously redness. There's some swelling I can see, very minor though, nothing extreme. You can close your mouth now. That's okay, thank you. So now I want to feel along the bridge of your nose, if that's okay. Any pain or discomfort there? No. Okay, what I want you to do for me, if you can, is just take a deep breath through the nostrils, please. How does that feel? Is that clear? Okay, I just want to press on this one nostril. Can you take a deep breath in through your nose again, please? How does that one compare? Okay, I'm going to go for the other nostril as well. Deep breath in, please. And how does that one compare? Okay, so some slight trouble breathing through the nose. I think what I'd like to do now is a quick smell test, just to see if your sense of smell has been affected by this. So I've got a few bottles of artificial scent here. I'm just going to give them a quick shake up, and then you can have a smell of them and try to identify them for me, please. Okay, so this is scent number 1. Can you tell me what that is, please? Strawberry, very good. I'll just try a few different ones. Okay, and we have scent number 2 here. If you could smell that for me, please. And what does that smell like? Pineapple. Very good, very good. That smells like mint. Yeah, very good. Okay then, so 3 out of 3. I would say your sense of smell is absolutely fine then. I'd like to move on to your ears now. First of all, I'm just going to use my regular flashlight here just to do a very quick visual inspection of the outside of your ear, if that's okay. So I'll begin with this one here. Okay, so looking pretty good so far. No excessive redness, no dryness of the skin. There's no pain, is there, when I press around these areas here? No, that's a very good sign. Okay, we'll move on to the other ear. Okay. Looks very much the same as the other ear actually. No excessive redness, no dry skin, nothing immediately obvious. And again, no pain when I do this. No. Okay, pretty happy with the initial visual inspection. Now I just want to actually use an otoscope to look deeper into the ear canal. You will feel this insert slightly into your ear. Shouldn't be too uncomfortable at all, shouldn't be any discomfort, certainly no pain. And it's just going to allow me to get a better look at the ear canal itself. So again, I'll start with this ear. Pop this on here. There we go. Let's have a look. What do you see? Okay. So there is a slight redness deeper into the ear canal. It is actually clear of wax, so it's not a wax buildup causing this problem, causing this redness. Probably is related to your sinuses and your trouble breathing. Okay, I think I'll move on to the other ear now. A quick look there. See if we see similar results in this one as well. Okay, yeah. Almost exactly the same as the other ear actually. There is some redness, but it is clear of wax. Again, suggesting the same sort of relationship as the other ear. Suggesting that you do have some sort of inflammation in your sinuses, your nose, your ears, your throat. And this is probably what is causing your difficulty breathing and the general soreness that you feel in the area. So I would like to do just a quick hearing test, very basic, rudimentary. I'm going to check each ear to see if this is affecting your hearing. So beginning with this ear, I'm just going to flutter my fingers. I'm going to move them further away from your ear, and when you can no longer hear them, please let me know. So beginning now. Yeah, that's pretty good. Let's go for this ear now. Yeah, similar range, that's a good sign. We'll do it once more each ear. Okay, very good on that one. Again. Okay, so they're both equally available to hear. Good range on both ears. Looks like the inflammation hasn't affected your hearing, so that's good at least. What I think I'm going to do is I'm going to apply an antibiotic solution into both of your ears now. Just going to shake it up, and I'll be using a cotton bud just to apply it into each of your ear canals. This should help reduce the inflammation, kill any negative bacteria that may be causing it. I'll also then prescribe you some antibiotics. Hopefully this will clear up the sinus sinus infection that I believe you have. Once you finish the course of the antibiotics, should be about 30 days. If you do not feel any better, please do make another appointment with us and we'll see what we can do from there. But hopefully this double treatment should solve the problem that you have. Okay, so I'm just going to start by popping a solution into this ear here, if I may. Okay, so if you could just tilt your ear back for me, please. Tilt your head back. Nice one, thank you. Okay, so we've got a bit there. Okay, let me know if I'm too rough or anything like that. If I make you feel any discomfort. But obviously I'm going to try and be very gentle. I'm only basically giving the very outermost edges of the ear canal a quick clean, but also making sure the solution reaches down deep into the ear canal where it will be most effective. Okay, and whilst I'm here, I'll give a quick clean on the absolute outer edges of the ear. Okay. How does that feel? Not too bad now. Very good, very good. And now that that's done, same thing for the other ear. So once again, if you could tilt your head to the side for me, please. Just pop a little bit of that in there. Very good. And we will begin. And I will begin with a brief clean again, just like the other ear. How's that feeling? Feeling okay? That's good. Very good. Okay. Now that that's been done, we'll move on to the outer ear cleaning. Again, not too rough now. Yeah. Okay, there we go. I think that's all done now. Okay, so from all the examination that I've done today, I'm quite happy that there's nothing majorly wrong with you. There is some sort of sinus infection, and that is behind the soreness you feel in your throat. You may feel soreness and stuffiness in the ears as well, and it's also behind the slight difficulty you're having breathing. But we've administered some antibiotics to the ears, a solution, and now I'm going to quickly write you up a prescription, and this will be for a course of antibiotics that you can take over the course of 30 days. It's one tablet, one pill per day after 30 days, then don't hesitate to make another appointment with us. But please do finish the full course of antibiotics. Even if you do start to feel better in the middle of, say, day 15, please still finish the full course of antibiotics just to make sure that they have cured the problem. Otherwise, the problem may come back a week or so later, and then it becomes more of a problem then. Okay, so there we go, that's your prescription. And is there anything else I can do for you today? Any questions you might have for me? No? All happy, all satisfied? Excellent stuff. Thank you very much for visiting today. Thank you for being such a good patient, doing so well during the examination. Thank you.